Okay, here we go. All right. My name is Amy, and we are debating about how stronger caffeine regulation and FDA oversight can improve the public health. Myself, Carlie, Kaylee, and Nate will first give evidence for why there should be more oversight, and then Mia, Kasie, and Kirra will provide opposing arguments. After, we will have an open discussion where both sides will have the chance to defend their arguments. Okay, let me present this. There we go.
All right, so we just wanted to first start off by kind of giving a basis of what caffeine really is doing to the body, to the brain. Um, that really is the basis of our argument why we believe that the FDA should have better regulation for caffeine. First off, caffeine's effect on the body starts in the brain. Caffeine is an adenosine receptor antagonist, and basically meaning that it blocks the neurotransmitter that signals the need for sleep to the body and the caffeine stimulates the release of adrenaline. This can lead to high blood pressure, which can lead to a strain on veins and arteries. Individuals with existing high blood pressure should steer clear of excessive caffeine intake. Caffeine in excess can lead to other issues such as insomnia, overexertion, tremors, and anxiety. And basically, the issue we're arguing is that without FDA regulation, there's not really a way of knowing how much caffeine is present in these energy drinks. It's hard for the consumers to know how much caffeine they're really consuming.
Perfect. Okay, so first, the lack of FDA regulation of caffeinated beverages leads directly to public health risks. So the first point, current FDA regulations haven't kept up with the explosion of high caffeine products marketed to youth. There are currently hundreds of brands of energy drinks and pre-workout supplements on the market, with new ones coming out regularly. And as popularity, demand, and volume increase, it is difficult for the FDA to control and regulate these products. Next, many caffeinated beverages like energy drinks and coffees don't have to list the exact amount of caffeine on their labels. This leads to people being unaware of how much caffeine they're actually consuming and sets the stage for accidental overconsumption and caffeine toxicity. And then lastly, because of the lack of regulation, some companies pack 2 to 4 times the caffeine of a normal cup of coffee into one can or bottle. And this far exceeds the serving recommendations. Um, let's see. So, for example, Prime energy drinks or Bang energy drinks, they see the recommended 100 milligrams a day for adolescents, and the recommended for adults is just 400 grams. So it's already pushing the limits of what people really need. And it's also ironic because they're advertising heavily towards youths through like social media and sponsorships of youth events. So they're really cutting it close with that daily limit. Okay.
Okay, so another one of our points that help back up our argument is that high caffeine consumption can cause harm. A Journal of Caffeine Research states that from 2005 to 2011, of emergency room visits due to adverse events from energy drinks increased tenfold to more than 14,000 reported symptoms, including seizures, arrhythmias, liver and kidney injury, and psychotic symptoms. Too much caffeine can lead to increased anxiety and nervousness by blocking adenosine and triggering adrenaline release. It disrupts sleep patterns, increasing the time it takes to fall asleep and reducing overall sleep duration. Excess amounts can cause digestive issues, muscle breakdown, dependency, and increased urination.
The following point that we kind of highlighted already is that youth are especially at risk. Research shows right now that caffeine intake among adolescents is associated with nervousness, irritability, nausea, cardiovascular symptoms, sleep, osteoporosis, and gastric ulcers. All of those are pretty detrimental to long-term health, as well as excessive use of energy drinks has been linked to death. And energy drinks are often targeted towards children and youth through carefully designed advertising campaigns as well as sponsorship of events, such as snowboarding and skateboarding competitions. And the CDC shared that as of 2024, almost 50% of parents were reporting that their child drinks an energy drink regularly. Following point goes along with what other parts of the world are already implementing into their regulation. We have, so that's just the international precedent. It does exist in Denmark, Turkey, Norway, Uruguay, Sweden, Lithuania, and Latvia, and Iceland. They've all banned or restricted sales to children under the age of 18. And Hungary and Mexico apply additional tax, ban the sale of energy drinks to minors under the age of 18, and they found a significance with 68% of teens reducing their intake, and they felt more aware of that health risk. Over here, regulations and what they have started to implement that has proven to be effective with those under the age of 18, over the age of 18, and even those pregnant and breastfeeding, as all of them do need more of that limit.
With all of this information, we think it's important that we come up with some steps that we believe the FDA could take. We know that there are quite a few adverse health risks that come with excessive caffeine consumption. So we think that energy drinks should be reclassified and regulated with caffeinated soda by the FDA. Caffeinated, be clear of the amount of caffeine present. Stated before, we see sometimes labels can be a little bit misleading with the caffeine that's actually present. And this last point here says that the FDA does not currently approve. So basically it's saying there's not a process that energy drinks have to go through to be approved as dietary supplements. This leads to kind of a loophole, right? Energy drink companies can kind of just label it as a dietary supplement, and they can pack in as much as they want of caffeine. And this can lead to, like we were talking about before, this miscommunication, that consumption of caffeine, and can lead to, issues that would be avoided if consumers knew exactly how much caffeine they were.
Okay, now we're going to move on to the rebuttals and why this stronger FDA oversight is unnecessary.
So, firstly, we want to talk about how moderate caffeine can be beneficial. So, drinking coffee has benefits beyond an energy boost, according to Johns Hopkins Medicine. You could live longer. Studies show that coffee drinkers are actually less likely to die from common diseases, such as coronary heart disease and kidney disease. And antioxidants in coffee produce healthy enzyme levels in your liver. Then, according to the National Library of Medicine, the large amount of caffeine in energy drinks provides the consumer desirable effects of improved memory, increased alertness, and elevated mood. Studies have shown that the consumption of energy drinks significantly enhanced aerobic endurance, mental performance on concentration tasks, reaction time, and especially beneficial for athletes. So the key to caffeine consumption is to moderate how much one consumes to properly benefit.
Okay, another thing I'd like to point out is that drinking caffeine does not mean someone is unhealthy. Be healthy even if they drink caffeine. So in efforts to improve public health, it'd be more beneficial to implement strategies to promote things like physical exercise, a healthy diet, hydration, improving relationships, and reducing stress. Well, caffeine isn't necessarily beneficial to humans' overall health. It is not something keeping people from having a healthy lifestyle. And an example of this is be drinking caffeine every day and still be considered to have a healthy lifestyle. But for example, if you're smoking every day, that you're not really having a healthy lifestyle, because smoking is more dangerous and leads to a than caffeine, making it something that should have more regulation and that the FDA should focus their turn their efforts to limiting things like that or other toxic substances.
And then just to expand on the issues of FDA oversight of caffeine, there are already a ton of current regulations and public products, especially on labeling of cans and such. By increasing oversight limits, this limits consumer freedom. The FDA already limits caffeine and monitors safety through the labeling, and it is honestly a personal responsibility of the consumer. Overregulation of the products won't fix a bad habit, but information and awareness allows the consumer to make decisions for themselves about what they want to put in their body. Stricter rules can honestly push small choice of a consumer and cause them to make more harsh choices, like using underground usage instead of just an FDA approved can. They might be using something approved by the FDA, which is more dangerous for them. And there's honestly minimal evidence of moderate caffeine intake having negative effects. There's only problems arising when there is overconsumption. To break down just some of the points that were being said earlier, the current regulations that aren't being strict. It just seems that most energy drink brands self-regulate and disclose caffeine levels, and that education and labeling is more effective than creating more laws that restrict it. To bring points about ER visits, most cases actually come mixing alcohol with energy drinks and misuse, not just everyday consumption. And then to point out teens needing protection from high caffeine exposure, there is parental guidance in school education that should be more effective in their solutions, and the labels that already warn them against the use for children. And then public health outweighing corporate profit, which is true, but stricter oversight might not actually improve health. But there is cases that moderate caffeine actually has proven benefit.
Okay, now we're just going to open the floor up for discussion. Any questions you might have, or let's just get um, some questions flowing. So I can start with one for the people that are against increased regulation. If current oversight is sufficient, how would you, I guess, explain the rise in caffeine-related ER visits and poison control calls? Um, I was looking up some statistics from 2022 to 2023. There's been a 24.2% increase in poison control calls for kids and teens under 20 because of, I guess you could say, overdosing on caffeine. So, um, if it's sufficient right now, how can we explain the increase in problems?
I would respond to that by saying that because the FDA is in place surrounding caffeine, we would suggest focusing more on educating the public about caffeine consumption so that we keep it at moderate levels to decrease these levels of hot.
Something I just wanted to point out real quick is that the FDA actually only regulates caffeinated sodas because those are under the category of food and drink. I think one of the loopholes that I mentioned earlier with the energy is they label their drinks as dietary supplements. And this allows them to kind of surpass, the FDA. The FDA doesn't have to approve their drinks for them to be bought, for them to be sold over the counter to, whoever wants to buy them. So I think that is one big point of emphasis in regulation, that we eliminate that loophole and make it so that, those energy drinks are treated the same as any other caffeinated soda, like a Coke, right? We know exactly how much caffeine is in a Coke, and that's pretty minimal, right? That the amount of caffeine in a Coca-Cola isn't really going to affect us and is not going to push us to be in the hospital, right? But I think, one of the biggest, concerns for me is the fact that I don't know how much caffeine is in a drink, regardless, of the label. It could say there's 100 milligrams of caffeine, but who knows, because they didn't have to be, there were no regulations that they had to go through as an energy drink company. to get those.
Okay, I have a response to that. Let's say that they do have regulations for it, and maybe that might mean somebody's not getting the same effect as they used to, like we talked about, that alertness and other effects that you get from the amount of caffeine you're taking. So that could cause people to just drink more caffeine and more energy drinks, which is putting more of those ingredients that aren't as good for you either way. So if they're if they are regulated, people would just drink more to get that same effect anyways.
A question that we can open up to the other side. Wouldn't taking valuable FDA resources away from be something that would like cause less urgent matters of public health concerns like foodborne illnesses or medication safety? I just think sometimes it might take away from the fact that we have a lot more urgent things in public health right now.
I think that there are a lot of urgent problems that we see, but some of the biggest problems that we're seeing right now are going to be those long-term chronic effects that are going to continue to affect our country. And so that, like these chronic heart conditions are impacting our youth so much that we won't be able to have sufficient, if we were to go to war, we wouldn't have enough people that would be healthy enough to be able to protect our country. And so I think all making sure that those short-term problems are addressed, but I think that we don't want to overlook those long-term problems that are actually going to cripple our country.
I understand your side. I just think one thing to understand as well is there's a lot of other hazardous things that people could be doing, like underage drinking, smoking weed, like marijuana and such. Like that's a really critical problem in today's society. And like, yes, energy drinks, if consumed like an overconsumption of it, yeah, that can lead to like cardiac effects and chronic issues. But I think overall, when you're educated correctly and you have the awareness of it, like personally as an athlete, like I choose to drink energy drinks because I need a pick me up sometimes. But I know not to drink one 7 times in a week because it's obviously not great for me. But like the benefits of having that just to like pick me up is more important than like I could be going out and doing alcohol and such like that. And I think that education needs to be a priority compared to caffeinated beverages.
That kind of leads into my next question for you guys. So if caffeine improves focus and performance, should it be considered a performance-enhancing drug in academics or sports?
Wait, could you repeat the question one more time? Sorry.
Yeah, no, you're good. So if caffeine improves focus and performance, should it be considered a performance-enhancing drug in academics or sports?
I don't believe so, no, because there's no like physical enhancement, getting more muscular or gaining more like bodily enhancements from that. All I'm doing is allowing myself to just have more fulfilled energy. Caffeine is something that like is regulated normally. I feel like that's not something that should be considered an enhancer. If it was something as strong as steroids per se or like creatine, then I would understand that. But I don't think caffeine has that high of an enhancement. Those kind of over the counter things.
And to add on to that, I would say the general population of America, everybody drinks coffee or some type of caffeine every day, and no one's getting these performance enhancement like things. It's more of just, a boost that they need throughout the day.
And also, sorry to build on that as well. And actually banned for certain things, so we don't even have the like ability to take enhancement drugs because we would be penalized for that. So I just think like adding on so dangerous. I feel like the NCAA like would have already banned the use of caffeine. Hence, like Celsius is a prime example of something because it has an actual enhancer in it, which is why athletes don't drink Celsius. But things like Red Bull and Alani or like Monsters don't have enhancement drugs in it, allowing us to just be able to drink caffeinated beverages, but it's not an enhancement for us.
Another thing, just to kind of add off of what they were saying, is that caffeine is very available for anybody. So if it is seen as a disadvantage to someone, it's easy for the other team or opposing also get that benefit because of how available caffeine is to anyone.
Okay, any other questions or topics you guys want to run through before we wrap it up?
I think we're good on our side.
Alrighty then. Let's just move on to the summarize.
Okay, to summarize, just the key points of supporting. I think the first point was regulation of the public is at a higher risk of not knowing what is in their drinks, and other caffeinated supplements that are included there. And then there are detrimental health effects that come from that has been proven. There has been success in other countries with caffeine regulation, and youth are at the highest risk, especially because of the targeting advertising.
Key points for the no side is that moderate caffeine consumption is beneficial and even healthy. Educating rather than more regulations can benefit consumer caffeine consumption. There are caffeine, and people can live healthy lifestyles even while consuming caffeine.
Hey, I think that's about it. And yeah, those are our sources. Thank you all for all you've contributed. And yeah, the
Thank you
end.
guys.
Thank you.
Yeah, good job, everyone.
Good job,
guys.
guys.
Guys,
Way to get it done.
Yeah.
I'm glad we got it done.
Do you guys want to see our costumes?